Good morning, everyone. Thank you so much for joining the Texas Southern University's Breast Cancer Screening and Prevention Center. We are really excited to have you all today for our health education webinar, Breast Cancer 101. Thank you so much, everyone, for joining us today. We are really excited to have you all here. The Texas Southern University provides no-cost screening and diagnostic mammogram services to ethnic minority women. Our focus is for ethnic minority women who are uninsured, but also underinsured. We are focusing on 5 counties, one being Harris County, the Grimes County, Matagorda County, Walker County, and also the Worden County. We also provide navigation and we provide patient navigation services to women with goals of reducing barriers or challenges that might get in the way of breast cancer care. So we provide navigation and barriers reduction services, excuse me, to women so we can make it easier for women to get breast cancer care. So we serve 5 counties in the state of Texas, and that would be the Harris County, Grimes County, Matagorda County, Walker, and Worden counties.
You can go ahead, Zamara.
Okay. We also provide breast cancer awareness and education in partnership with our community partners. For more information, you can text us as seen below. You can text TSU Breast Center to 855-264-9031, or you can scan the QR code or email us. So we want to welcome you all for joining us today. Thank you. At the end of the presentation, you will have an opportunity to ask questions, and you can write those questions down, and then we can share that information with our presenter. We want to give the Gethsemane Church a thank you for having us today. We can't do the work that we do without you, so we want to give you all a big thank you. But specifically, we also want to give Ms. Shireen Herman a thank you for helping us with this event. We also want to give a big thank you to the Chinese Community Center and a special thanks to Ms. Ashley Olvera for also helping us put this event together at the Chinese Community Center.
Ningependa kupeana pia shukrani kubwa kwa kikundi cha Wachina katika mji huu wa Houston na sana kwa Mama Ashley Olvera ambaye pia amechangia pakubwa sana kwa mkutano huu kuweza kufanyika leo.
At the end of the presentation, we will have a survey for you to take.
Go ahead, Zamara.
Thank you again for joining our health education webinar, Breast Cancer 101. I would like to introduce our guest today, Dr. Solmaz Karimi.
Mgeni wetu wa leo atakuwa Daktari Solmaz Karimi, ndiye atakayokuwa anazungumzia katika fursa hii.
Ms. Solmaz was born in Tehran, Iran. She is a postgraduate year 2 oncology pharmacy resident at the Houston Methodist Hospital. In her current practice interests include hematology and hematopoietic stem cell transplantation. And in her spare time, she enjoys hiking. She likes to dance. She likes to travel, and she likes to spend time with her family and friends. And without further ado, I will go ahead and pass the torch on to Dr. Solmaz. Thank you again for being here with us, Dr. Solmaz. I will stop presenting for you to share your screen.
Thank you, Zamara. Hello, everyone. Thank you for having me here today. I'm very excited to be here with you and discuss breast cancer screening. So before we begin talking about breast cancer, I think it's important to discuss what cancer is in general. So cancer is a disease in which some of the body's cells grow rapidly and uncontrollably and spread to different parts of the body. Our bodies are equipped with intrinsic mechanisms to eliminate cells that are damaged before they can turn cancerous. Sometimes because of genetic factors or environmental factors, abnormal or damaged cells can grow uncontrollably. These abnormal cells, under normal circumstances, would be eliminated by our body's defense mechanism. But because of genetic and environmental factors, they will multiply and grow uncontrollably. These damaged cells can form what we call tumors, which are essentially lumps of tissues and cells that aggregate together. These tumors can either give rise to cancerous cells or they can remain benign. If they give rise to cancerous cells, these cancerous tumors can spread or invade nearby tissues. They can also travel from one part of the body to another part of the body, what we call metastases. So now that we know about cancer, what is breast cancer? It's the same concept, except these abnormal cells now arise from the breast tissue. So breast cancer is the most common type of cancer in women in the United States. It most commonly occurs in older women with a median age of diagnosis above 55 to 64. It's estimated that in 2023, there will be about 297,000 new cases of breast cancer. In 2023, it's estimated that there will be around 43,000 cases of death from breast cancer. So an average woman has a lifetime risk, as shown on this slide, as in 1 in 8 women will be diagnosed with breast cancer in their lifetime, which is why it's important to know early signs of breast cancer. We'll start with the top left picture. So these are some of the things that you can see and observe for when you do your breast self-examination. In the first picture, you can see a retracted or inverted nipple. The following picture shows a breast or a nipple pain or swelling. One of the easiest signs to note on your breast self-examination are lumps under the arm or around the breast tissue. So any swelling around the breast or the nipple, any color changes around the nipple, and any texture changes like skin texture changes. Some patients might have some redness or even some discharge from their nipple. And this discharge would be different than milk during breastfeeding. There are risk factors that are associated with breast cancer. Some of these are modifiable, as in they are things you can change. Others are non-modifiable. So this slide has some of the risk factors that you cannot change. This includes your age. So as you get older, you're at a higher risk of breast cancer, as well as your gender, with females having a higher risk. Most importantly are the genetic risk factors, as well as your personal and family history. If you have a first-degree relative, that would be your sibling or your parents, or second-degree relative, so those would be your grandparents, that had breast cancer, ovarian cancer, or other types of cancers, that puts you at a higher risk of breast cancer. If you or your first-degree relative have BRCA mutation, and that's BRCA, that also puts you at a higher risk of breast cancer. If you had your first kid after the age of 30, or if you have never had children and you're older than 30, that puts you at a higher risk as well of breast cancer. So this slide has some of the risk factors which you can control. This includes your diet, making sure you're eating healthy foods and limiting your consumption of alcohol, making sure that you're maintaining a healthy weight, both through the food that you intake as well as regular exercise. Research has shown us that smoking, as well as being exposed to chemicals that can cause cancer, and working nighttime shifts, increases your risks of all types of cancers, including breast cancer. There are some disparities when it comes to risk of breast cancer as well as survival from breast cancer. This slide focuses on the different rates of breast cancer in African American women compared to white or Caucasian women. African American women are more likely to be diagnosed with breast cancer at an earlier age than Caucasian women. African American women are twice as likely to be diagnosed with a more aggressive form of breast cancer, which is called triple negative breast cancer. African American women are also more likely to have inflammatory breast cancer, which is not only rare, but also more aggressive form of breast cancer. So we'll talk about screening, and the goal of early screening is to catch breast cancer in the early stages so that it can be cured and contained. Screening is typically done through mammograms, but sometimes ultrasounds or CTs can also be done, as well as biopsy, which is an excision of the tissue or fluids within the breast mass. This is the breast self-examination that I was referencing earlier. If you are in the premenopausal period, it's important to do your breast self-examination after your completion of your menstrual cycle. So day 7 or 10 of your menstrual cycle. It's also important to make sure that you're doing your breast self-examination around the same time each month. If you're postmenopausal, you can pick any date in the calendar, but make sure to stay consistent. You can start your breast self-examination in front of a mirror by raising your hands over your head and examining your breasts for any discoloration, any abnormal texture, or any raises in the skin, so like lumps. You would do the same examination with your hands on your hips, as well as hands on your side. Next, you want to make sure that you squeeze around your breast to see if there is any discharge or any pain that you're experiencing. And you would repeat this for both breasts. You want to raise one arm at a time and check for any lumps or redness or swelling under your arm. Next, you want to, in a circular motion from your nipple and outward, check for any raises in the skin, any discoloration, or any lumps in your breast tissue. You can do the same steps now, moving from outside of your breast towards your nipple. Lastly, you want to repeat these steps, both the circular motion from outside to the nipple, as well as straight strokes while lying back on your back. Now, you might question when you should get screening done. The American Cancer Society has guidelines to help us with screening. This slide has information for average risk females, and these are patients who have no personal history of breast cancer or family history of breast cancer and have not had any chest radiation before age of 30. In women who are over the age of 40, you can start screening with a mammogram annually, but it's only recommended by the guidelines to start mammograms annually after the age of 45. Women who are 55 and older can either continue with annual mammograms or switch to every other year mammograms, as long as their risk has not changed. Women who are high risk, and these are patients who have the BRCA1 or 2 mutation that I was talking about, or a first-degree relative with the BRCA1 or 2 mutation, as well as women who have had radiation therapy to their chest between the age of 10 and 30. For these high-risk women, it's recommended by the American Cancer Society to have breast MRI and mammogram every year starting at age 30. Okay, this is data from the NIH SEERS criteria where they look at stage of breast cancer at initial diagnosis. And this is between 2011 and 2020. So most breast cancer is diagnosed at an early stage, what we call localized, where surgery or even radiation might be enough, and there might not be any need for chemotherapy. About 5 to 10% of breast cancer is caught at a late stage, where it has metastasized or moved to a different part of the body. The 5-year survival between the years 2013 and 2019 is shown in this graph for females with breast cancer. This slide highlights the importance of early detection. As you can see in the localized and even regional breast cancer, 5-year survival is above 75% in both those situations. If caught early at a localized stage, the cure rate is as high as 90%, and the 5-year survival is as high as 96 to 99%, depending on ethnicity and race.
Thank you so much, Dr. Solvaz.
Of course, thank you for having me. I'd be happy to answer any questions that you may have.
So one question we did have, Dr. Solvaz, was earlier, one of the audience members asked, why is that? Is it because of our diet? So she was inquiring about the breast cancer diagnoses, I believe, and I guess she's trying to figure out if it was related to our diets.
So I believe the diet and lifestyle definitely has an important role, but I think the bigger component of this, and if you remember from the chart that I was showing where the stage of diagnosis is, you could see that African Americans were typically diagnosed in a later stage or more likely to have a later stage diagnosis. And those later stage diagnoses typically have poorer outcomes in general, irrespective of race. They're harder to treat, they're usually more aggressive. And so that's part of the reason for that. But diet and lifestyle plays an important role as well. Unfortunately, one other issue that could be at play here is also access to care, barriers to seeking care. Having those issues in place doesn't help the situation either. And so they're less likely to seek treatment earlier. As you saw, the 5-year survival in earlier stage localized disease is great. You can have 5-year survival of 96%, 98%. However, once you move to that distant stages, that 5-year survival drastically drops. And so if you're not detecting it early enough, it puts you at increased risks, which is why programs like this are great help and asset to the minority community or the uninsured, underinsured communities. And it's very important to raise awareness, to get folks to get themselves checked out, take care of themselves. And that breast self-examination that I went over is huge, huge in detecting some of those things ahead of time.
Thank you so much for that.
Of course.
And I also believe we have one more question here. Bear with me. Maybe would like a few minutes. Just give us 1 second while we get that question from the audience here. In the meantime, we do have another question that came in, Dr. Solmaz. The question says, how does working the night shift increase the chances of breast cancer?
So it's not necessarily the nighttime shift working, but more so the habits and working patterns around the nighttime shift working. You're more at risk of not being as active, not having a good balanced diet, your circadian rhythm, which is your body's way of balancing out when the night starts and when the day starts and all the hormonal balances that go with that, those are the things that put you at risk, and not necessarily the working at night, but kind of the habits around working at night. You're more likely to have access to poorer choice of foods, those that are more processed, such as the ones from fast food restaurants, as more healthier options are typically limited in the evening shift. As well as just physical activity. You're less likely to be physically active since you're working at night. And I would assume that you'd be resting during the day to kind of balance that out. And so I hope that answers the question.
Thank you so much, Dr. Somas.
Of course.
All right, so I think those are all of the questions that we have. I do thank you again for your time and for being here with us today. I also want to thank the church for having us today, for allowing us to host. I want to thank the Chinese Community Center for being with us as well and for hosting our audience. I want to give a huge thank you to both translators. Thank you all for your patience, Ms. Olvera, Ms. Shireen as well. Thank you again for allowing us to borrow your space and to partner with you all to be able to do the outreach and to do the work that we do, because again, we truly cannot do what we do without your help. It is truly impossible. And so with that being said, we will go ahead and wrap up. I have uploaded a link on our Q&A so you can take a survey following the presentation. If you can please take that, we would greatly appreciate it. And then very important, if you are able to, if you are in need of a mammogram, please contact us, and I am going to upload this information here so that way you can have it. Yes, so again, if you are in need of a no-cost mammogram screening, please contact us at 713-313-4424. You can scan the QR code that appears on your screen now, or simply email us. Again, we thank you all for your time. Dr. Solmas, thank you again for everything and the wealth of knowledge that you've shared with us today. Hope that you all have a wonderful day.